Welcome, everyone. Today we're taking a deep dive into something we all experience, but don't always talk about: pain management. We'll be exploring some really insightful thoughts from a medical professional who's right in the thick of it every single day. When you think about it, there's so much more to dealing with pain than just taking a pill.
It really is about the whole person, isn't it? This expert really stresses that just writing a prescription isn't the answer. It's more than that. We have to really listen to how people describe what they're feeling, how it affects their daily life, not to mention the emotional and social stuff, too.
Yeah, it's seeing the person behind the pain, right? It's not just a physical thing.
Exactly. They even told the story about a patient who had a bad experience with morphine. They told the doctor straight up, "I hate it. But the doctor didn't really listen and just prescribed it anyway. It just shows how important it is for doctors to understand what patients have gone through before they decide on treatment.
Oh, wow. That's rough. You'd feel like you weren't heard at all. That makes me wonder, do you think it's common for people, maybe especially older folks, to kind of downplay their pain?
All the time. This expert actually calls it the good patient barrier. Especially with older adults, they try to act tough and say everything's fine, even when it's not. They don't want to be a bother or worry their families. You know how it is.
So then how can a doctor get past that? If someone insists they're okay,
Yeah.
how do you know if they're really not?
It's tricky, isn't it? The expert mentioned a case where a patient says she was doing fine, but her daughter, who's there with her, she was giving all these looks and signals that said something totally different.
So you have to pay attention to more than just what they're saying, like their body language too, right?
Exactly. You've got to look at the whole picture. That's why this expert really pushes for families to be involved in these conversations as much as possible.
It's interesting, right? The family can be such a help with pain management, but it's often overlooked. Why does this expert think it's so important to have them involved?
Well, think about it. Family members are usually the caregivers. They're the ones who see the impact of the pain day in and day out. They notice things the patient might not even realize or might not want to talk about.
Like how it affects them at home, if they can do the things they used to enjoy.
Exactly. And it's not just about giving information, it's also about addressing their concerns, too. There was this one situation where a patient was terrified to use morphine because they thought it would make them a target for burglars.
Really? That's not a fear you hear every day.
Right. It might sound strange, but it was a very real fear for that patient. And it shows you have to take those fears seriously, even if they seem odd, and find another way if you need to. In that case, they ended up using a different medication that didn't have that same risk, at least in the patient's mind.
So what we're seeing is that pain management isn't just about the physical feeling. It's all tied up with emotions, psychology, social dynamics, and even just the practicalities of everyday life.
It's all connected, and to really understand it all, you need time. Doctors are often under pressure to see as many patients as possible, and that doesn't leave much room for these kinds of in-depth conversations.
I can see that. It makes sense that that kind of time crunch leads to a less thorough approach.
Yeah, but here's what's interesting. This expert thinks that spending just 5, maybe 7 minutes truly listening to the patient and dealing with their concerns is way more effective than a rushed 30-minute appointment where the doctor does all the talking. Those few minutes of real attention and empathy make all the difference.
It's quality over quantity, right? Making every minute count. I bet that's easier said than done, though.
Yeah.
Are there things that make it hard to do that consistently?
Oh, there are definitely challenges. Things like insurance companies dictating how much time doctors can spend, the sheer number of patients they need to see it makes it tough to give that kind of focused attention to every single person. But even small changes in how doctors communicate and approach things can have a big impact. That's what this expert believes anyway.
So it's about working smarter, not harder, right?
Oh.
Figuring out how to make the most of the time they have.
Exactly. And that's where it helps to get the word out, The more we understand about pain management as patients and caregivers, the better we can advocate for ourselves and the people we care about.
Knowledge is power, right?
Absolutely. If you know the right questions to ask, what to watch out for, and how to talk to your doctor, you can make a real difference in making sure pain is managed in a way that actually improves your life.
I think this gives us a really good starting point for understanding the human side of pain management. But now I'm wondering how all this applies to a specific group, older adults.
That's a great point. Older adults have a lot of unique needs when it comes to managing pain.
Right, so let's dig into that a little deeper in the next part of our deep dive and figure out how we can use these insights to help older adults manage their pain and live their best lives.
When we're talking about older adults specifically, it's important to remember that pain can show up in a lot of different ways, and sometimes those ways are different from what younger people experience.
Oh, that's interesting. So you're saying pain might actually present differently in older adults. Like, what
hmm
would be an example of that?
Well, just think about it. As we get older, our bodies change, right? We might have more wear and tear on our joints, which leads to things like osteoarthritis. Or we could have conditions like osteoporosis, which makes us more prone to fractures.
Right. So the root cause of the pain might be different for older adults.
hmm
And I guess that also means the way they experience pain and how they describe it could be different too.
Exactly. Older adults might not use the same words as younger people to describe their pain. Instead of saying it's sharp or burning, they might say it's aching or stiff.
That makes me think about that good patient thing we were talking about earlier. If older adults are already downplaying their pain, and then they're not even using the typical language to describe it, it seems like it would be really difficult for doctors to figure out what's really going on.
You're hitting on a really important point. We need to be extra careful when we're listening to older adults. It's not just about what they say, but also their body language, their expressions, all of that.
So it's like you're a detective, looking for clues beyond just the words. And that's another reason why having family members involved is so helpful, right?
Absolutely. Families can be a real bridge in those communication gaps. They might pick up on things the patient doesn't even realize, like changes in how they're moving, how well they're sleeping, or even their mood. All of those can be signs of pain.
And family can also give some background on the patient's medical history, right?
Hmm.
Like old injuries or chronic conditions that might be contributing to what they're feeling now.
You got it. It's all about putting the pieces of the puzzle together to really understand what the person is going through.
Okay, so we've talked about how aging can affect the causes and the experience of pain. What about when it comes to treatment? Are there any specific things to consider for older adults?
Definitely. For one thing, older adults are often more sensitive to the side effects of medications.
So, like, the same dose that would be fine for someone younger could cause more intense side effects for an older person.
Exactly. And it's not just how strong the side effects are. Older adults might even have different side effects altogether.
That makes sense. Our bodies change as we age, so I guess the way we process medications would change too.
Exactly. Plus, a lot of older adults are already taking multiple medications for various health issues.
Oh, right. Like for their heart, blood pressure, diabetes, it can be a lot to keep track of.
Absolutely. And that's where things can get complicated. All those different medications have the potential to interact with each other, which can increase the risk of side effects or even make the medications less effective.
It's like you're trying to balance on a tightrope, finding the right medications and doses that manage the pain without causing a whole bunch of other problems.
Exactly. And that's why it's so important for everyone involved in the patient's care, doctors, pharmacists, nurses, family members, to be talking to each other. They all need to know what medications the patient is taking to avoid those potential issues.
So it sounds like teamwork is super important here. Everyone working together to make sure the patient is safe and doing well.
Exactly. And that teamwork should include the patient themselves. Older adults need to feel comfortable speaking up about their pain, any side effects they're having, and any concerns they have.
It's about being an active part of their own healthcare, not just following orders.
That's it. And that's another area where family can really help. They can encourage the patient to communicate their needs, advocate for them if they need to, and just be there for them emotionally through the whole process.
This reminds me of what we were saying earlier about pain management being about more than just medication. Are there any non-drug approaches that are particularly good for older adults?
There are tons. Physical therapy, for example, can be really great for older adults. It can help them stay mobile, strengthen their muscles, improve their balance, all of which can help reduce pain.
Right, so it's about addressing the actual causes of the pain, not just covering it up. What about things like occupational therapy?
Occupational therapy is fantastic for helping older adults adapt their surroundings and their activities so that things are easier and less painful. For example, they might recommend using assistive devices, making some changes to the home, or finding ways to simplify everyday tasks.
So it's about practical solutions that make a real difference in how they live their lives.
Exactly. And don't forget about mind-body practices like yoga, tai chi, or meditation.
Oh yeah, I was just going to ask about those. They can be so good for managing stress and helping people relax, which can definitely help reduce pain indirectly.
Exactly. And there's more and more evidence showing that these practices can actually directly affect how we experience pain by changing how our brains process those pain signals.
It's amazing how connected our minds and bodies are, and how taking care of one can help the other.
Absolutely. And that brings us back to that holistic approach we've been talking about throughout our deep dive. When it comes to pain management for older adults, there's no one-size-fits-all solution. It's about creating a plan that's tailored to their specific needs, physical, emotional, and social.
So if someone listening to this is worried about pain management for themselves or a loved one, what's the first thing they should do?
The most important thing is to start talking to a doctor. Don't be afraid to be open about your pain, how it's affecting you, and ask about different treatment options.
And finding a doctor who specializes in geriatric care could be really helpful, Ray.
That's a great point. Geriatricians are specially trained to understand the needs of older adults and can often come up with more targeted pain management strategies.
This has been so insightful. We've talked about so much, from the basics of how we feel pain to specific ways to manage it in older adults. But I'm curious about the bigger picture now. How does pain management, or maybe even the lack of effective pain management, impact society as a whole?
That's a great question, and honestly, it's one we need to talk about more. The truth is, whether or not pain is managed well has huge consequences that go way beyond what individuals experience.
So it's not just about the personal toll of pain. We're talking about societal impacts, even economic impacts.
You got it. And that's exactly what we'll be getting into in the last part of our deep dive. We'll look at the wider societal implications of pain management, things like the burden on our healthcare system and the ripple effects on families and communities.
I'm really interested to hear about that. It's clear that pain management is a much bigger issue than we often realize. So we've talked about how pain management affects individuals, especially older adults. But now I'm curious about the bigger picture. What kind of impact does this have on society as a whole?
Well, just think about how many people are dealing with chronic pain. It's a lot. And that puts a huge burden on our healthcare system.
Right, all those doctor's appointments, hospital stays, medications, it all adds up.
Exactly. And it's not just the direct costs of treatment. When people can't work or have to take time off because of their pain, that affects productivity too, which impacts the whole economy.
It's like a domino effect, right?
Yeah.
One person's pain can end up affecting a whole bunch of other people and systems.
You got it. And then there are the social and emotional consequences. Chronic pain can lead to isolation, depression, and put a strain on relationships. It's tough to enjoy life when you're in pain all the time.
It's like pain creates a barrier, not just to physical things, but to connecting with others and feeling good emotionally.
Yeah.
So where do we go from here? What can we do to address these bigger impacts?
I think one of the most important things is to change how we think about pain management. Instead of just trying to mask the symptoms, we need to take a more holistic approach, one that deals with the physical, emotional, and social aspects of pain.
Yeah, treating the whole person, not just the pain itself. But that probably requires a pretty big change in how we approach healthcare in general.
It does. We need to invest more in research to really understand how pain works and develop better treatments, both with medications and without.
And what about making sure people can actually get the care they need? Not everyone has equal access to specialists, physical therapy, or counseling.
That's a big problem. We need to make sure that everyone, no matter their income or where they live, can get quality pain care. It's about creating a system that supports people in managing their pain effectively.
It sounds like education is really important too, both for patients and for healthcare providers. They need more information about pain and how to manage it properly.
Absolutely. We need to clear up any misconceptions and give people the knowledge they need to make good decisions about their care. And we need to get rid of the stigma around pain, especially chronic pain.
Because right now people feel ashamed or embarrassed to talk about their pain, like they're weak or something.
Exactly. We need to create a culture where pain is acknowledged and dealt with, not ignored or downplayed. It's about validating people's experiences and letting them know they're not alone in this.
That's a really important message. So for our listeners out there, what's the one thing you hope they'll take away from our deep dive into pain management?
I hope they remember that pain is a complicated experience that deserves to be treated with care and understanding. It's not something you have to just suffer through silently. There's help out there and people who care.
Don't be afraid to speak up, advocate for yourself, and seek out support. Managing pain is a journey, but you don't have to do it alone.
That's a great way to put it. Even small steps can make a big difference. Start by talking to your doctor, doing some research, or connecting with others who understand what you're going through. There is hope, and there is help out there.
Thanks for joining us on this deep dive into the world of pain management. It's something that affects us all in one way or another, and we hope this conversation has given you some new insights and maybe even inspired you to take action. Remember, you're not alone. Until next time, keep exploring and stay curious.